Hi there, in this video, I want to talk about strokes. A stroke is a clinical condition that occurs when certain areas of the brain lose function due to a blockage in the blood vessels or bleeding. About 80% of strokes are caused by blood clots or blockages in the vessels, while 20% are due to bleeding within the tissue or between the layers of the brain. There are risk factors for strokes. These include factors like smoking, high blood pressure, diabetes, heart diseases, vascular diseases, heavy alcohol use, stress, and insomnia. And of course, we also have family factors. If we are prone to vascular occlusion, our risk of stroke may be slightly higher. In cases of brain bleeding, especially if we have uncontrolled high blood pressure, congenital vascular disorders, or aneurysms, those balloon-like swellings in the blood vessels of the brain, these also become risk factors for bleeding. Of course, if we're using blood thinners, or have certain hematological conditions, our tendency to bleed or clot can also increase. How do we recognize a stroke when it happens? A stroke occurs suddenly, it happens all at once. What could happen? We might have vision problems, speech difficulties, a droop in our mouth, numbness in our arms and legs, loss of strength, loss of balance, trouble walking, or changes in our consciousness, like feeling drowsy. Changes in awareness, like a blank stare, can also be a sign of a stroke. So what do we do when a stroke happens? First, we'll call 112. Because calling 112 connects us to what we call stroke centers, which helps speed up the process and ensures our transfer to the right facility and the start of our treatment. What happens when we arrive at the emergency room? There, they do a CT scan and an MRI, blood tests, an electrocardiogram, and tests for any underlying chronic conditions are being done. The relevant specialists evaluate the situation and, based on whether it's related to my blood or a blockage in the vessels, we adjust our treatment accordingly. But we really emphasize the timing. The most important thing is to reach a center within the first 4.5 hours and to do so through 112. Because, during those first 4.5 hours, treatments to open up the vessels, or methods like thrombectomy, where a clot is removed mechanically using the Arjo technique, can only be done within a limited time frame. After that, we do follow-up checks to understand why these issues happened and what our vulnerabilities are, and we conduct these assessments in neurology clinics. So, can we prevent a stroke? Yes, we can prevent it. How will we protect ourselves? We will protect ourselves from the risk factors we just listed. So, we'll cut down on smoking and avoid heavy drinking, sleep, stress, and our chronic illnesses, especially if we have high blood pressure, diabetes, if we're obese, or if we lead a sedentary lifestyle. We need to take a good look at these and shape our lives accordingly. We also need to make sure our doctors regularly monitor our chronic conditions. I hope I've been helpful.